Nguyen. Dr. Giang Nguyen is the Executive Director of Harvard University Health Services, and he is the Henry K. Oliver Chair of Hygiene. He provides strategic vision and oversight for the department's clinical services, public health initiatives, emergency preparedness, compliance and accreditation, health insurance compliance, and immunization compliance programs. So clearly someone who sounds like they had a busy year this year. Very, very pleased to welcome him. And he'll be speaking on mental wellness, especially as it relates to these unprecedented times we're living in and the role that he has played at Harvard through this time. So with that, I will stop my share, and I'm very pleased to hand over the microphone.
So thank you so much for the introduction, and many thanks to the organizers of this event for inviting me to speak to all of you. It's always a pleasure for me to be able to interact with folks who are learning and planning a future in whatever leadership role you may have. Hopefully this event will help you along that journey. So greetings from Harvard University in Massachusetts. The land occupied by Massachusetts was the home for a variety of tribes, including the Wampanoag, Pequot, Nipmuc, Massachusetts, Mohican, Nauset, Pocumtuck, and Pennacook people. And we are thankful for their contribution to the history of this great land. I start by saying that I speak today on behalf of myself and not for Harvard overall. I do direct the University Health Services at Harvard. We have about 23,000 students in our university in 12 different schools, from the undergraduate college to our graduate and professional schools like the Graduate School of Arts and Sciences, the Harvard Business School, the Harvard Law School, and the Harvard Medical School, where I hold my faculty appointment. Not including all of the faculty in the nearby Harvard-affiliated hospitals, our campus community includes close to 50,000 people. That's like a small town nestled within the broader communities of Cambridge and Boston in Massachusetts. So what does my organization, the University Health Services, do? We are a multi-specialty health center with satellite offices and an athletics field house. We care for students, faculty, staff, spouses and partners, and even retirees of the university. We have a counseling center for our students and a behavioral health department that serves faculty and staff. And we have the Center for Wellness and Health Promotion, which offers health education, peer counseling, response to alcohol and drug concerns among students, classes on mindfulness, yoga, and meditation, as well as acupuncture and therapeutic massage. And we manage 2 health insurance plans as well, responsible for 30,000 covered lives, students, employees, and family members. So we keep busy. I'm also a member of the board of directors of the American College Health Association, which is a professional organization of people who work in the field of college health. And I'm a member of their COVID-19 task force. Dealing with COVID-19 at college campuses has been my focus for nearly a year and a half. And it is interesting to think about how we have evolved over that year on so many levels. At the forefront of our work has been the health and safety of everyone in our university community. And knowing that people interact with each other across artificial boundaries of job function and role, it's critical to remember that in order to protect any subset of our community, we need to think about everyone in our community. The students living in dormitories interact with student affairs staff, with faculty, with dining hall workers and facility managers, housekeeping and custodial staff, and security guards, and many others. One of our critical decisions last March was to send the majority of our students home and to convert almost all of our university functions, including learning, to a virtual platform. I had started using Zoom a little bit prior to the shutdown, but for most of our campus, this was uncharted territory, and so we had a lot to learn. And for our health services, which had a long-term plan of implementing telemedicine. Um, this was a real kickstart to doing that in real time. So technology was critical to the success of this endeavor on many levels, but even more important was the ability to pivot when things change and to be both responsive to and communicative with our communities. Um, and communication across the schools, units, and divisions has also been critical um, on an administrative level. So, such coordinated activity is really rare at a complicated, siloed place like a university. In most places like Harvard, the schools, the various units, the different centers, all kind of exist in their own world most of the time, and they do their own thing. So, um, being able to respond collectively to something as big as a pandemic really forced us to think of this complex organization as a whole. And I think we grew a lot as a result of that. We figured it out because we needed to. So you keep in mind that even though we sent most undergraduates home, there were still a lot of people on campus: essential workers, laboratory research staff, residential staff, and some students could not leave because they had no acceptable place to go where they could successfully learn remotely. So we permitted them to stay in the dorms. We also had and some undergraduates who were living in private apartments in the area. So what health issues have we needed to deal with during this time? Certainly, evaluating environmental conditions, including building capacity and air quality, doing surveys of all of our spaces. We established safety protocols on campus, including distancing, masking, hand hygiene, surveillance testing. These probably sound familiar to some of you who have had that experience in your own communities. What I'll describe in terms of the things that we did was acceptable and possible in our organization. But it doesn't mean that that's the only correct way of doing things. Every community, every organization, every university, every institution of learning has to come up with its own solution in a way that works with the resources that are available and with the local community situation, because the pandemic hit different communities in very different ways. So that's always important to think about as we consider how various organizations respond. So here, the Broad Institute of MIT and Harvard began doing polymerase chain reaction PCR testing for COVID-19 in late March 2020. And our university community started official surveillance testing of our essential workers in June of 2020. The Broad Institute has been responsible for testing universities, nursing homes, and many other organizations across the northeastern US. And they have processed over 17.8 million tests so far. And here at Harvard, we have processed about 500,000 tests for our community alone, thanks to the work at the Broad Institute. We established a very effective program for students, faculty, and staff living in dorms to be tested 3 times every week. And that cadence was less frequent for other populations, depending on how often they were on campus. And to reduce barriers to testing, folks did not even have to go to a testing facility. We provided kits that folks could activate from the comfort of their homes and their dorm rooms. They self-swab, and then they deposit the specimens in a collection bin placed. We have bins placed all over campus. And then University Mail Service collects that and several times a day, and then we have additional staff who sort and process those specimens in preparation for lab testing. So for anyone who tests positive, we established isolation housing so we could effectively separate infected persons from the broader community with in-person nursing checks as well, meal delivery, and frequent phone and Zoom check-ins. Thankfully, our students, even those with symptoms from COVID-19, have in general done well physically, and we're so thankful that everyone took this incredibly seriously and folks were heavily engaged in all of the safety protocols that we set forth. We kept infections among students relatively low, and we're very grateful for everything that our students did, because it was without the students participating as they did, we would not have been able to keep those infections low. But really, mental health has been a major concern for college populations at this time. Social development is a very important component of young adulthood, and physical distancing has not helped. Um, but it was necessary. We had to do it in order to keep the pandemic at bay. But the sense of isolation among students has certainly risen over the past year. So, to support this aspect of our students' experience, we've done a number of things. We provided remote counseling and psychiatric visits, even for students who were physically quite far away from campus. And that required that we consider a lot of legal implications and licensing implications. It was quite complicated. And then offering virtual support groups was also incredibly helpful. And we did that at various times of day. So it was interesting that you all had a, a version of this 12 hours ago or 10 hours ago, and then you're having one now in order to support people in different time zones. That's exactly what we did for our virtual support groups for our students, because we have students who are studying remotely from the US on the East Coast, as well as on the West Coast of the US, and also from places like China and other parts of the world. So we had to be able to provide opportunities for all of those students to feel supported. We also had Zoom yoga classes, mindfulness sessions, and meditation classes. And we worked very closely with faculty and student affairs colleagues because supporting the mental health of students is not the sole job of medical providers. We are a community, and everyone plays a role and can play a role. And finally, we established community health leads within our residential communities and among our students. And so that really helped to have a student voice as well. So what do you think of when someone mentions mental wellness? I think for many people, we immediately jump to thoughts of mental unwellness. How do you define mental wellness in students, in high school students, in college students? I think we often jump to thoughts of stress, of depression, anxiety, suicide. We think about emotional pain. And yet, mental wellness is not the mere absence of emotional pain. It can and should be so much more. The World Health Organization defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. And so, mental wellness, yes, can be the absence of uncontrolled emotional pain. But we should also view it as the presence of joy, of meaning, and connectedness. And that presence of these things might happen also not just in the absence of pain, but sometimes despite the presence of pain. Right. So I like to think of well-being according to a framework that we use here at the University Health Services at Harvard, and I'm going to share that with you so that you can get a sense of how I think about well-being. So as you can see here, it is a multidimensional construct. Certainly, of course, we have physical well-being and emotional well-being, but the relational well-being is so critical. This is the relationships that we have with other people, the social engagements, the social relationships that we have. And in addition, we have well-being that is driven by the work that we do, the vocational well-being, the intellectual stimulation that we have when we are learning things that excite us, and the wellness that we achieve through the environment that we're in. And of course, there's also spiritual well-being. And that isn't just religious well-being, which of course can be very important, but also a sense of purpose, a sense of meaning. And all of that is is something that contributes to one's spiritual health. And financial well-being is incredibly important as well. And I can think of many situations when I've dealt with students who were struggling financially, and you could see how that financial struggle led to physical and emotional and many other areas of their well-being being affected. So, uh, what are some tips that each of us can do to promote our well-being? Um, with regard to relational or social well-being, it is so important for us to intentionally find connection with others, um, and to really make time for it. That is something that we don't always do because we find that we're so busy trying to achieve the things we want to achieve. I think as students, we often feel that it is um, it is something that we do when we're done with all the other work. But finding connection with others is a human need, and so we all need to find time to do that. We only also need to find time to uh, nourish our bodies and strengthen our physical well-being, and that includes eating the right things, keeping ourselves hydrated, staying away from drugs, um, and tobacco, and exercising, and again making time for all of these things. We make time to wash ourselves, we make time to brush our teeth, we make time to study, and we need to make time um, to promote our own physical and relational and all of the other aspects of our well-being. With regard to spiritual well-being, I really think that it's so important for us to think about what is our meaning, what is our purpose, and that takes time to explore, especially as a young adult. And so, um, it is valuable to think about these things, but it's also something that you don't have to beat yourself up if you haven't come up with your true meaning yet. Um, that will come as you get older and as you evolve through your life. But start thinking about uh, what value you find in the things that you do and what does it mean. And then finally, for environmental health, uh, I always encourage people to place themselves in spaces that promote their health and that bring them joy. So, I can go through all of these other lists one by one, but I think you can all come up with things that you would consider to be um, things that you can do to promote your well-being in all of these aspects. And when we think about emotional wellness, all of these pieces will then contribute to the emotional well-being that you have. But more specifically to emotional well-being, you need to spend time building your skills, so that you can be resilient from an emotional standpoint, because there will always be times when these other aspects of your well-being present challenges to you, and there are things that you can't control. So I always think about the importance about being able to sit with discomfort, to be mindful of your own feelings, and to recognize the feelings of others who are around you, and to be able to step back from a situation and sometimes to accept the things that you can't change, while recognizing that you control how you respond to those things that you cannot change. And now it may be that you cannot change it right now, and you will um, potentially work very hard to change the things that you see are wrong with this world. But the truth of the matter is, there are things that today you cannot change. And being able to understand that and to be able to sit with the discomfort of knowing that some of those things are unchangeable in the moment, I think is very important for one's emotional resilience. So take time to reflect. Take time to express gratitude for the things in your life that you are thankful for, because all of these things we know um, are going to promote your own well-being. Um, and it is very important to say explicitly that all these things I mentioned about promoting your own well-being, these things do not have to be achieved without the participation, assistance, and guidance of other people. We must all ask for help when we need it, and look for resources when we don't have them, and take care of ourselves. All of this is so incredibly important, and we don't achieve this alone. Um, when we achieve well-being on multiple levels, we don't just survive, um, but we thrive and we flourish, and we can do it even in the midst of a pandemic. So, with that, I will stop sharing, and I will take any questions.
That's wonderful. Again, that was really wonderful. Thank you. I enjoyed the session this morning, and I enjoyed it in a whole different way this afternoon. So thank you. And I mean, it's an interesting talk. I mean, on the one hand, you're talking about this huge logistical challenges of managing this huge community and making sure that everyone is well, and then again, some very wonderful sort of advice on a personal level about how to manage some of these challenges. Like this morning, we've gotten some great questions, and I'm happy to share them with you. The first, it's a really good one. The first one, it says, in terms of the methods that institutions like universities have used to cope with mental wellness needs of students, how will we be able to tell whether or not those actions were successful or not?
That's a really terrific question. There are many ways in which organizations assess the well-being of our students. So there are surveys that can be done. So many organizations, mine included, will do surveys of our students where we ask them to describe how well they're doing, and so we can track those things over time. Um, there are uh, there are measures that exist that are validated, where we can understand degrees of anxiety, levels of depression. These things have been studied in multiple communities and populations, different age groups, and all over the world. And so we're able to use those things also to assess how well folks are doing. We can also look at things like utilization of various health services and various resources on campus, because um, if we start seeing that the wait times uh, for visits with the counseling center are increasing, um, uh, because more and more people are trying to access those services, for example, then that may be a sign that things are getting worse for our students. So we keep track of all of those things. Thankfully, over the course of the pandemic, we have had very good access for our students to get care, and they've really appreciated and have often voiced this to our providers, about how appreciative they are that our providers have been able to offer care to these students, even though they are many, many miles away from campus, so that they can get the support that they need.
Mm, Wonderful, thank you. And just to build on that, I assume that there is a very active and growing both sort of domestic and international community, sort of academically, between institutions, talking about the needs of their students and sharing, what they're doing and how their students are feeling. I guess Harvard would, I'm sure, would be engaged in a number of those communities as well.
Absolutely. So I mentioned the American College Health Association. Before that is an organization that has thousands of health professionals who are all dealing with the health of college students, and we are often engaged in these conversations. And there are many other organizations like that as well that are also dealing with these things. And and we have communities of practice among all of our various universities. So the Ivy League schools all get together and talk about these things, and because there are certain experiences that are specific um, to the experience of a student in an Ivy League institution. And there are similar types of communities of practice in other organizations as well.
Got it. Again, some great questions have just flown in from my colleague Alex. This is a great one, and given the global diversity of this group here together, would you consider the concept of mental well-being to be different depending on the cultural or social surroundings of students?
That's yeah, all of these questions are always so terrific. The the world is so diverse, and I do believe that there are different ways of expressing um, joy and pain across various communities. And so the words that we use may be very different, um, and the way that we express how we're feeling may be very different. Um, so yes, there is tremendous diversity, and I think that's what is important is for communities as they become so much more multicultural and global that people take time to understand each other and to understand how we express ourselves, because um, otherwise you could miss when someone is demonstrating the fact that they are struggling. So especially in many of our colleges and universities, we have a tremendous number of international students, and so being able to support those students is a really important part of what we do.
Got it. So I promise you another good question here that's been just shared with me. So it says that, COVID-19 has definitely changed the dynamics of academics, but some things haven't changed, such as the competitive nature and reliance on marks for entering universities and programs. And I'm just adding graduate school. So what are your thoughts on this?
Yeah, competitiveness is something that students struggle with a lot. What I've also found is that sometimes that competitiveness is self-imposed, and that we interpret the expectations of others in a way that if you ask them um, out front what their expectations were, uh, they wouldn't be nearly as high as the expectations we put on ourselves. So I think that it is very important um, uh, for students to recognize that, but also to be able to give yourself permission to not be perfect all the time. And you know, I see this in not only students, but I see it in professionals all the time. And certainly, when you strive for excellence in what you do, you can produce amazing things, right? So it's important to be able to do that. But if you expect perfection um, all the time for everything, then you can actually do some harm for yourself, because in order to achieve that, you have to give up on something. And sometimes um, the things you give up are um, are too important, really, to give up. So I think that that's important. But one of the other things that I have found helpful is the conversation that students have with each other about the competitive environment, because those cultural aspects of competitiveness are among students, and students can make a change. I have seen this when students talk about, for example, the competitive nature of getting into certain student-run organizations, and many student-run organizations um, have reduced the level of competitiveness there because they felt that there's enough competitiveness everywhere else, and why should we make it that much worse for each other? So we've certainly had a lot of those types of conversations as well.
Got it. The students will soon be moving to their breakout rooms, but I thought a question just came in, hopefully not too personal, but certainly, all of us, all the people who are helping other people, of course, are dealing with this on their own level. So this question was directed at you by one of our students, who said, what are some steps or strategies that you personally take to manage your own mental wellness as you're managing the mental wellness really of a community of 50,000 people?
Well, thank you for that question. That is it's important, because I think that when you ask folks for how they deal with these stresses, it might give you ideas for how you would do it yourself. And um, what I try to do is build in my own personal well-being as much as possible into the standard way I do my work. So I have a set of standard work that I do on a weekly basis, and I track that. So I have to meet with my direct reports on a regular basis. I need to attend particular meetings on a regular basis. I put those on a list on a single board that I keep track of, and every week I look back to see what I've done. But on that list also includes other things. I include exercise on that list. I include sleep on that list. And I assess whether or not I got the amount of sleep that I targeted for myself every day. And I track it. And then at the end of the week, I reflect on it and I say, did I achieve everything that I set out to achieve, including the things that promote my own well being? Did I exercise? Did I sleep at least 7 hours a night? Did I connect with people? Did I um, work on my own professional growth? So all of these things I put in there, and I'm very intentional about that because what I realized is that some of these things that we feel we don't have time for, we actually do have time for, and it doesn't take as long as we think it would. I think most of us will occasionally stop and read a post on Facebook or watch a YouTube video. Those things add up, and sometimes even if you just take a little bit of that away and then you replace that with something that really promotes your own well-being, it's incredibly valuable. One thing that I try to do every week, for example, is I reach out to at least 5 people that I haven't interacted with uh, in a while. And that increases my sense of connection to other people. But at the same time, it probably helps that person that I reached out to, because who knows how, if they're struggling with loneliness or isolation. And the fact that if I haven't talked to them in a while, maybe a lot of other people haven't talked to them in a while. So we can all play a role in each other's well-being by doing these things intentionally.
Wonderful. Again, I have enough great questions to keep this going, but obviously, the night moves on. So, Dr. Nguyen, on behalf of Convergence, on behalf of all the students here, and certainly me personally, I'd just like to thank you for your time. It was enormously valuable, and it was great insights again on like the big picture on the institutional level, and but very profoundly on the personal level as well. So, again, thank you very much.